Dementia residents need to understand that they are experiencing memory loss so that they can navigate their situation. They need to know that getting lost is not just about getting old, and that when they start forgetting the way to their sister's place, when they've been going there for the last 20, 30 years, it's not just because the years are building up, and they're 80 years old now, but rather it's a memory problem, and it's called dementia. You may or may not want to say dementia, but at least to explain that it's a memory problem. So that in this way, people with dementia get to understand that actually not remembering the way to the supermarket, not knowing the way to their sisters, not knowing how to get to their neighbours and back even, just a few doors up the street, is a specific problem. And when they get to understand that this direction orientation, this memory loss is part of dementia, then they'll start to accept the repercussions of that. Because if they get lost, they get lost somewhere on a highway and they get picked up by police, then it's a very dangerous situation. It's risky, it's dangerous, it's scary. And of course, that only needs to happen 2 or 3 times. And once the police and the doctors find out about that, it's often a dementia unit that the person is referred to. And of course, that is difficult in itself. Entering a dementia unit has lots of advantages in that it's secure, but disadvantages because it's so unfamiliar. So a lot can actually be done to help orientation in dementia units though, and it needs to be done to help the person orientate, because now they're in an unfamiliar setting. They're not knowing the people. They're not knowing the layout. They're not familiar with medical systems or the whole routine of the unit. They don't know the staff. They don't know anyone there. So that is incredibly disorientating. And even though they're there for their safety and all their cares are done for them, which is good, still they need to be able to orientate. They need to be able to get from their room to the lounge, and from the lounge to the dining area. They have to be independent with that most of the time. I mean, staff will help when they can, but to be able to independently go from the lounge to their bedroom when they want to go to the toilet in between toileting rounds, or they want to lie down and have a sleep, they have to be able to independently do that. So help can be given for this direction orientation. It's really just from their bedroom to the lounge and the lounge to the bedroom. That's really the main track they need to know, because lounge to dining area is often in close proximity. Everyone goes at once. You just need to follow the crowd and staff are there to guide you. But lounge to bedroom, that's really important to know, because otherwise you've got no autonomy or independence. You're really so reliant on staff to just get you to your room for toileting, and that's about it. And then again for bed at night. But it's nice to be able to lie on your bed when you want to and look out the window and have your own peace in your own room. Actually, it's really important to have a space for peace in your own room to wind down, because it can be very stressful being in a dementia unit. And if you know you've got your bedroom to go to and relax in, it's easier. But certain things need to be put in place, as a good 60% of people coming into dementia units have poor direction orientation. So to help with this, if door identification is set up with the name in big letters at eye level for the dementia resident and the number of the room, if a coloured slick or a big photo, recognisable photo for the dementia unit, for the dementia resident, and lots of practice to and from the room, explaining to your mother that this is, practice for her to be able to find her room, and just guide her along the corridors. If it's 4th on the right from the nurse's station, just take her through that. Okay, mum, we're up to the 1st room, 2nd room, 3rd room, read the names, read the numbers. Okay, here, 4th room, your room, very good. Get her to read the sign, read the name, and then of course she's arrived. So this practice can easily be done those times that you visit the dementia unit, and just include it in with your normal visit. And that extra practice will go a long way to her being able to identify her room and be able to get there with the support and help of staff who often say, you know, fourth on the right, Mrs. Jones, you know, there's your room. Or sometimes alert residents, the neighbours, will help you as well. But if you're independent in this way, it helps a lot for quality of life in a dementia facility, having this orientation to finding your room. So I've written 2 books on these topics, The Resident's Voice and The Resident's Rise, both from a dementia unit, and both on Amazon and my website, link below. So thank you for your comments and your engagement and your viewing, and for those of you that have subscribed. And please, those of you that haven't subscribed, please do so if you're interested in this channel, and pass on the links. Thank you.